For OAE testing, the probe must be securely inserted into the baby's ear canal. Massage the front of the ear canal and pull down and out on the outer ear to pop open the ear canal. Select the appropriately sized ear tip. If there is visible debris or fluid blocking the ear canal opening, it may be best to wait a few hours for the ears to dry out and then retry. There are two styles of OAE probes available with the GSI Novus, the snap probe and the universal probe. The preferred style was selected at the time of purchase. The snap probe is a specifically designed probe for infant ears. The single-use probe tips are designed to fit securely into infant ears and to prevent wax and debris from reaching the delicate electronics in the probe body. Choose the proper size snap probe infant ear tip based on your inspection of the baby's ear canals and snap it into place. If you are using the universal probe, select the appropriate sized ear tip. The red phalanged ear tip fits most newborn ears. However, you may have to select a different size tip based on the size of the infant's ear canal. Place the ear tip firmly on the probe. Regardless of the probe style, pull gently down and out on the baby's earlobe to open the ear canal. Aim and twist the ear tip gently but securely into the baby's ear canal. Release the earlobe and ensure that the ear tip is firmly in place and will not easily fall out. It helps to position the probe cord toward the top of the head to maintain the correct angle in the ear canal. Do not hold the OAE probe during the measurement since this can cause noise.